You're listening to Edge of Faith, a multimedia magazine where we discuss art and culture through a Christian lens. So Matt, thank you so much for stopping what you were doing and taking the time to talk to us today. How are you?
I'm good. How are you? Thanks for having me.
Yeah, we're doing great. So we're here to talk about grace for the children, finding hope in the midst of child and adolescent mental health. So this is a follow-up book from a previous volume you wrote called Grace for the Afflicted. Could you tell the audience a little bit about that book first, and then maybe we could discuss what made you decide to write this book?
Yeah, Grace for the Afflicted is primarily about mental health issues that you would find in adults, but looks at each issue like depression or bipolar disorder from a scientific perspective, but also from a biblical perspective. So I wrote that book because over the years, as someone in mental health, people would approach me and ask me questions about their own mental health in faith communities, and a lot of times they were very spiritual questions, and so I was really interested to kind of look at that and see how pastors and believers look at mental health issues and how might they be better ministered to.
Right. So, I guess with that being said, we can go straight into Grace for the Children. I can't think of a better way to get people, I guess, involved, or at least involved in our conversation this morning, would be if you were to tell the story that was the beginning of chapter 1. When I read that, I just thought that was such a sad thing, the way people maybe miscommunicate or don't understand how to work with children.
Yeah, that story, I'll tell you where I was and then I'll tell you the story. I was just doing a training for pastors at a small conference and on mental health. And that was during the question and answer session. So a female pastor, she asked me, and there were probably about 40 to 50 pastors in the room. She said, I have a new family that just started at my church, and I need some guidance on how to minister to them. They've really been hurt by the church. They have an 8-year-old son, and he has some, pretty significant mental health issues, which caused him to be pretty disruptive. And in the previous church they went to, the leadership of the church actually got a restraining order against the family or the child to keep them from being able to come because they found him so disruptive. And it was, you could have heard a pin drop. I mean, it is a very disturbing. I mean, I've heard a lot of bad stories, so I won't say it's the worst story I've ever heard, but I mean, it's got to rank up there with some of the worst. To think that a church would ever imagine that would be an appropriate response for a struggling family and an afflicted child really is disturbing at its core. And it really shows that a lot of times within the church we can get into being more concerned about our Sunday morning experience or these traditions that we follow than the people that God is sending to us for ministry.
Right, absolutely. This might be a good time, too, to really get a little deeper into child and adolescent disorders and maybe discuss how prevalent that really is in our country and how few children actually get help.
Yeah, absolutely. I think, we think about mental health problems, or I should say maybe we talk about mental health problems as if they're kind of adult issues. But the reality is that a majority, or I should say 50% of all chronic mental health conditions are in place by the time someone is 14 years old. That's a shocking statistic. And then 75% of all of these conditions are in place by 24 years old. So you're looking at, kind of mid to late adolescence when a lot of these things first appear, like bipolar disorder or schizophrenia and depression. Unfortunately, half of all children and adolescents with mental health care problems never receive any treatment. And more than half, a majority of adults with mental health problems never receive any treatment. So people are struggling with very significant psychiatric conditions and just suffering. They simply never receive any treatment, and they and their families are left to try to deal with the fallout from that.
Right. So would that mean that the system is broke, that people don't recognize that their children and even, adult friends need help? I mean, what are some of the problems there?
Yeah, the system is horribly broke. I mean, the reality is that we really don't have a system. We have a disjointed set of resources that people, frankly, if I just had someone in my office yesterday say a statement that I've heard hundreds of times, and that is, I literally have no idea where to even start to find my child care. Because who do you call? Do you call a therapist? Do you call a psychiatrist? Do you call a pediatrician? I mean, where do you go? And so people just don't know what to do. And then another problem is finances. This care is expensive, like a lot of medical care, and insurances tend to not pay for it. And we let them get away with that. We don't require them to cover it. A lot of people, if they were to check right now, they would find, surprisingly, that their insurance policy doesn't even cover mental health care. Lots don't. And then, thirdly, you have stigma. There's an enormous stigma associated with mental health issues. People are shamed, particularly in the church. They're looked at as weak in their faith, or maybe this is a sin issue. And so people will not go get the help that they need, or they'll minimize their own problem and not seek help, thinking that, well, if I do that, then someone will know I have a problem and then they'll look differently at me. So it's a very complex issue. I think with children, what you have is, what I see a lot of is, children will begin to behave oddly, and typically, since they spend most of their time in school, they're recognized in school early. And the problem there is that they're kind of shunted then down a kind of a bad kid, bad behavior pathway, not a mental health pathway. Or the family is told this may be a mental health problem, and I've seen parents just outright deny that their child has a mental health problem when they are being told by a mental health care provider that the child does, because of the shame associated with that. And so, in a study that we did a few years ago, I did with a graduate student of mine at Baylor University. We surveyed youth pastors in the southeast of the U.S. on different mental health problems that they are working with in their congregants. And so, how many are working with this? And over 80% of them said at that moment they were working with a youth that was struggling with depression. And over 70% said a youth that was struggling with an anxiety disorder. I mean, those are just astronomical numbers. So the faith community is a great place and a great opportunity to really recognize people early and then be able to engage them, not just with mental health care, but with spiritual care that provides hope and support as they move forward in their recovery.
That kind of hits on the next question that I wanted to ask was, how could the church help to address some of these issues? So obviously the church needs to be more involved and more educated as well, but then I guess perhaps help their congregants as well. Is that how we get started?
Yeah, absolutely. I mentioned one of the statistics already that just kind of drives my life, and that is the idea that, and the fact that a majority of people with mental health problems receive no treatment. Well, the second one that drives my life and really brought me to be doing what I do today and writing these books that we're talking about is the fact that in the United States today, people in psychological distress are more likely to go to a clergy before they go to a mental health care provider or physician. So we know that people are more likely to go to faith communities first. And what's particularly odd about that statistic, which was found by the National Institutes of Health, is it's not just people that are already affiliated with faith communities or people who consider themselves believers in God. It's anyone in the general population is more likely to engage a clergy before they engage a mental health care provider or a physician. And so that's a real opportunity. In fact, I would call that a divine opportunity. I mean, I would say, as a person of faith, God is literally sending people to us, and we need to be prepared for it. Now, the disturbing part of that is that we find that less than 10% of clergy ever make a referral to a mental health care provider. And I think that's predominantly, and the surveys suggest this, is because they just simply don't recognize what's sitting in front of them. I mean, people aren't walking in and going, I'm here because of a mental health care problem. They're walking in and saying they have other issues, and it's a mental health care problem that's the real issue. So I think, training with clergy so that they recognize mental health care problems, connecting clergy and ministry staff and lay leaders to providers in the community that they feel comfortable referring to. And then I think also setting up supportive care services within faith communities like support groups and peer mental health coaches and ways that people can actually receive some level of service for free right there at the faith community as part of the spiritual life of the church. I think that really is really the answer to kind of this crisis we have in our country. And those are the kind of things that we're doing here at the Hope and Healing Center in Houston. We right now are have trained in 92 congregations around Houston. We have support groups out there. We've trained over 2,000 clergy and ministry staff. We have peer mental health coaches, which are just laymen that have been trained to provide some level of service. And so we're really growing that across the city, and just about to move into school districts as well and start doing training with teachers and parents in schools. So the issue is, we know that a majority of people are not getting care, and so we know they're not going to clinics. So it doesn't do any good to build any more clinics. We need to open doors where they're going, and the primary place they're going are to churches.
Absolutely. You bring up clinics, and we kind of discussed that earlier with the broken system is that's part of the issue too, right? It's not like a smooth transition from if someone needs this type of help and they go to a clinic, or this type of help to a counselor, or if it's a more serious issue and they need to have some kind of resident help. I mean, it just really isn't set up to help people today, right?
No, not at all. I mean, if you look at if you want to look at the most severe of patients who require some kind of hospitalization, at best an insurance policy is going to pay for maybe a week. I mean, the average in the U.S. is 4 to 6 days of treatment, inpatient, and then you're just kind of dumped back on your family. If you wanted true, kind of what you think of mid to long-term care, which could be months. So you imagine somebody who's delusional, who's suicidal, who needs to be put into hospital. I mean, the thought that in 4 days you could somehow fix that is laughable, but maybe in 3 to 4 months you could get this person stable. Well, that all is direct pay. I mean, you have to pay out of pocket for that. I mean, right now in the U.S., half of psychiatrists don't even take insurance anymore because the reimbursement rates are so low and so few policies even cover it that people just have to pay out of pocket. And then, as you said, this kind of disjointed mess, if you go to a psychiatrist, it's unlikely that psychiatrist even works with a therapist that does talking therapy.
Right.
They'll just give you medication and send you on your way. But what the research shows us is that clients do best when they receive talking therapy and medication together. And when they do that, they have to take less medication. So the reality is the system is just, like I said, it's just kind of, it's resources that are just kind of out there. I live here in Houston, Texas, and it's the fourth largest, almost the third largest city in the U.S. It's just barely smaller than Chicago. In fact, there's some argument right now that maybe it's surpassed Chicago. We have this enormous medical center here. One of the greatest cancer hospitals in the world is here. But in Houston, Texas, Harris County, which is the county it's in, the fourth largest city in the country, there's only one psychiatrist for every 8,500 people. So, and we know that 1 out of every 5 people in the U.S. is struggling with a mental health problem in a given year. And, it's the same thing for therapists. There just aren't enough therapists. There are not enough. In the United States today, there are less than 100,000 psychiatric beds in the entire United States. I mean, it almost seems like I make that number up. It's so low. I mean, 300, so the reality is that we just basically just kind of ignore these people and we let them suffer. What we've done with the majority of them is we put them in prisons and jails or on the street. So 64% of jail inmates have a mental health problem and 30% of the homeless. So, it's a real crisis. I mean, frankly, it's sinful. I mean, what we've done. We are allowing people to suffer when, and don't misunderstand me. We have effective treatments. The majority of people who receive treatment get better. So it's not like we can't treat these things. These things can be treated. They can be managed. People can live wonderful quality of life. The problem is the majority of people just don't receive care. If I were talking to you right now and I said a majority of people in the United States with cancer don't receive any treatment because the system's broken, there would be people rioting in the streets.
Right, absolutely. I guess that's what I was going to bring up is, much of our homeless problem, not all, but much, is due to that. I mean, it's not like you can just give them some medication, which they can't afford, but you have to give them some time to get stabilized and be able to get on their feet, and that's just not going to happen, right?
No, absolutely. And you see the same kind of, almost laughably bad approaches to care. The gentleman's picked up by the police, and if he's, and he'd say he's delusional and he's on the corner, and if he's deemed to be a risk to himself, hopefully he makes it to the local indigent psychiatric facility, and they keep him there for 4 days or so. And then at the end of 4 days, they discharge him. He's usually taken down to the city's bus stop, and he's given a bottle of pills that will last a month and a prescription and left there. And it's with no follow-up, with no place to live, with no support. I mean, I see this every day. And to the thought that this is somehow going to make this gentleman better. And you're right, he needs a long-term kind of a bit time to become stable, and then he needs stability. I mean, 30% of the homeless have a serious mental illness, and if you add in substance use on top of that, you're looking at over 50% of the homeless. So 50% of the homeless have a mental health issue, but we don't approach it that way. We approach homelessness as if it is more of an issue of physical structure. The reason that you're homeless is because you don't have a home. And that's usually kind of the least of the issues. So it's the same thing with jail inmates. In 44 states in the United States, the largest psychiatric facility in the state is a jail. It is here in Texas. It's the Harris County Jail. This is an opportunity for the church to lead, because the people in psychological distress, people struggling with these problems, are going to churches first. But unfortunately, churches are just kind of oblivious to what's happening. Now, the reality is, though, churches actually have been involved in mental health care for a long, long time. They just didn't realize it, because they're involved with the homeless, they're involved with the addicted, they're involved with prison inmates, they're involved with human trafficking, they're involved with natural disasters where people are left traumatized. I mean, they're involved with these groups already, and they're connected to them unlike any other organization is. They just don't have a mental health component to those ministries. And that's one of the things that we're trying to encourage churches to do, is to say, look, mental health is ministry. If you're going into Haiti after an earthquake and you bring people food and water, that's a great thing. But when you leave, they're still absolutely, completely traumatized. So how about bringing them some trauma care, some trauma relief? And so we've developed resources for churches where they can provide those types of things. And so I really think that, mental health is the great ministry opportunity of the 21st century. And there's no other condition where the individual is more likely to go to a church before they go anywhere else, whether they're a believer or not. So if that's not a divine opportunity, I don't know what is.
Amen. Well, I guess we're coming up to a close. Do you have any final thoughts you'd like to leave for us today?
I would just say this: it's really not that difficult. Frankly, a lot of people say, well, I don't know anything about psychiatry, or I can't add in another program at my church. If you would simply do what for people with mental health problems, what you do for people with any other problem, with the guy with cancer, the family who has the sick child, the woman who's pregnant. A lot of times, a friend of mine, Amy Simpson, she's an author and a speaker. She refers to mental illness as the no casserole illness, because, you tell somebody at a church that you've got stage 4 pancreatic cancer. They don't know anything about cancer, but they'll show up at your house at night with a casserole just to show you that they care. You tell them that, your 28-year-old son's in the psychiatric hospital because he just got diagnosed with bipolar disorder and he's delusional. That, from what our research shows, is that may be the last time that they ever speak to you, because they're so fearful. And so, if we would just show the same compassion for people with mental health issues, if we would offer up prayers at the end of our services for people with mental health issues, if we would, offer support groups and those types of things in our faith communities like we do for people that have addictions, that would go a long, long way. So just do what you do for others. Show the same compassion, and I would kind of qualify that with this caveat: God is sending them to us, and I think that we just can't overlook that. We just cannot overlook that.
So what I'm hearing is you're saying just, walk with God, which is to walk in love.
Absolutely. Absolutely. I mean, this is all about grace. I mean, I've never, mental health, people ask me a lot of times I was trained as a neuroscientist. That's what my doctoral degree is in, and I've done research most of my life. And, people say, well, what is working with mentally ill taught you? Working with the mentally ill spiritually, what has it taught me spiritually? It's taught me what grace is all about. Grace is limitless. And when we try to kind of boundary it or constrain it or define it, God drops a guy in our lap that, is delusional and he's a mess and he's messing up our service on Sunday morning, and or an 8-year-old kid who's making so much noise in the Sunday school class that the church actually goes out and gets a restraining order against the family. I mean, what an opportunity for grace. What an opportunity to teach your congregation what it is to love someone unconditionally, as opposed to say, we don't want you here, which what the family hears is God doesn't want you here.
That's sad. Well, sir, thank you once again for sharing with us. Thank you for writing the book, Grace for the Children, IVP Press. Everyone should pick up a copy and get more familiar.
Well, thanks for talking with me.